Hello, everyone. Thank you for logging into our sharing session this morning. I'm Dr. Kit, and I'm the program leader of the MAAP.
I'm Dr. Na. I'm the co-program leader of MAAP. So together we have a team of applied psychologists who are from the three specialization of counseling, educational, and clinical psychology.
Both of us are graduates of the NAP program. I'm a counseling psychologist, while Dr. Na is an educational psychologist.
Yeah, we are full-time faculty members in NIE and practicing psychologists in the field. We work in hospitals and schools before we join NIE as faculty members. I currently practice in a clinical setting, while Dr. Kit practice in clinical, corporate, and school settings.
Very often, when people think of psychologists, they usually think of a therapist sitting on a sofa in a nice room, talking to a patient who is either sitting or lying on the couch. But not all psychologists work with clients while sitting on comfy sofas. In fact, most psychologists are only trained to do research, either in the field or in a laboratory. So only a few specializations in psychology focus on using psychological theories to help those in need. You have probably heard of the term applied psychology. Some people have asked us what this term means and how applied psychologists are compared to clinical psychologists. I'm glad we have this opportunity to answer this question. Well, the term applied psychology refers to the practical application of psychological theory, principles, and theories to real world challenges. In other words, applied psychology is a practice of psychology to help people and organizations to thrive. This is unlike pure psychology, which covers all branches of psychology and which focuses purely on research. So here's an overview of some of the psychology specializations found in Singapore. The academic departments of most universities here have research psychologists who investigate the why and how of human development, behavior, social cognition, and education. However, in Singapore, the application of these research findings are done by psychologists from only 7 specializations of clinical psychology, counseling psychology, educational or school psychology, forensic psychology, neuropsychology, occupational or industrial organizational psychology, sports psychology. Psychologists from all these 7 specializations are known as applied psychologists.
We are often asked if all masters in psychology program produce applied psychologists. This is an important question to ask because it does affect the choices you make. Since there are two types of psychologists, there are also two types of Master of Psychology program. There are the Master by Research program that seeks to broaden and deepen one's knowledge of human behavior through coursework and research. There are also professional psychology degrees which focus on specializations within the applied psychology field. Applied psychology program have the additional component of a practitioner skills acquired through practicum in the field. So we have probably heard the recent announcement on the upcoming registration or regulation of applied psychologists. This move towards mandatory registration is designed to protect members of the public by ensuring that only qualified practitioners are allowed to practice. Note that there will be only 5 of the 7 specializations that will be under the mandatory registration from mid-2027, and they are the clinical, counseling, educational, forensic, and neuropsychology.
Now that you're familiar with areas of practice in Singapore, let's have a look at what our Master of Arts Applied Psychology program offers. The MAP program has undergone many changes in the past few years. We have consulted employers about their needs as well as taken into account feedback from the registration bodies before our restructuring process. NIE's MAP is the most established and the first professional that is applied psychology program with a practicum component in Singapore. We have been offering the counseling and educational psychology specializations since 1997, and to date, we have produced over 500 psychologists for Singapore. Many of our alumni are leading psychologists in the field today. From January 2027, we will start offering clinical psychology as our third specialization. This is because we have always had clinical psychologists on our team, and we now have a program structure that supports new and existing specializations. The MAP program now offers 3 separate degrees. Each student may only graduate with 1 degree, but alumni may choose to re-enroll in the program to train in a different specialization. The MAP program is taught by practicing psychologists trained in the US, UK, Australia, and Singapore. We are all SRP registered psychologists and approved supervisors who are actively practicing in this field. The NIE faculty teaching in the MAP program have PhDs, while our part-time instructors and clinical supervisors have either master or doctoral degrees. In terms of admission criteria, applicants should preferably have good bachelor's degrees in psychology and at least 2 years of relevant work experience. Applicants for the counseling and clinical psychology specializations will also need to show proof of basic counseling skills either from an undergraduate course, external training, or on-the-job training. Most jobs that require counseling skills will provide this training as well. Applicants can also take a Skills Future course in basic counseling skills. Relevant work experience for the counseling and clinical psychology tracks include social work, youth work, or counseling work with at-risk or vulnerable populations. Educational psychology applicants should have teaching or educational assessment or therapy experience with children and adolescents with special educational needs. Please note that individuals are admitted on a purely competitive basis, and the majority of successful applicants have at least a second upper honors degree in psychology. Please also note that we do not allow transfers between specializations. This is because the admissions requirements and processes for each specialization are completely different.
So many people have asked us, what's the difference between the different specializations? There is also the common perception that one psychologist from a particular specialization can do the work of all those in the other 2 specializations. However, this is not entirely correct. So while there are commonalities across the 3 specializations, the actual work and population served can be distinctly different. Clinical psychologists are involved mainly with diagnosing and treating individuals with moderate to severe mental health issues, such as psychosis, mood, anxiety, or personality disorders. They also engage in prevention work, such as psychoeducation, so as to prevent relapse. In contrast, counseling psychologists work mainly with the normal population struggling with mild to moderate mental health issues, such as mood and anxiety disorder, adjustment issues such as life transition, relationship problems, or trauma. They also seek to build resilience and promote personal growth and well-being. Educational psychologists like myself specialize in diagnosing developmental and learning difficulties. We also work with the teachers and special education needs officer to help to implement classroom and individual interventions. Due to the differences in the populations and cases that each specialization works with, different types of applied psychologists are found in different settings. For example, Clinical psychologists are most often found in hospitals and other private and public clinical settings. Counseling psychologists are usually found in community settings, schools, and civil service settings dealing with special populations such as prisons. However, counseling psychologists are increasingly found in community-based or primary healthcare, such as polyclinics and GP clinics. In the corporate world, counseling psychologists are also found in employee assistance programs. Educational psychologists work mainly in mainstream and special education schools, as well as community-based early intervention centers. We also work in the child development units of hospitals. Now, the work of counselors and counseling psychologists overlap a great deal, but yet they are very different. Both counselors and counseling psychologists work with the normal functioning individuals all ages who are struggling to cope with significant stressors in life, relationship difficulties, and life transitions. In addition to this, counseling psychologists also work with individuals with special needs, such as mental illness, abuse, and trauma. Unlike counseling psychologists, counselors are not allowed to administer Category C psychological assessments. In addition, due to the severity of clients' issues, counseling psychologists may work with clients over a longer period of time than counselors do.
Now let's take a deeper dive into the MAAP curriculum. The MAAP program structure comprises a mixture of compulsory and optional coursework, 3 practicums totaling 1,000 clock hours, and a dissertation. Only the core courses, specialization core courses, practicums, and dissertation are required for graduation. In addition, you may also take up to 2 optional courses. Although the grades for optional courses appear in your transcript, they do not count towards graduation. However, these courses allow you and your employer to customize training to meet specific industry needs. More information on the types of courses offered may be found in the MAAP website under the Curriculum tab. Please note that the MAAP program does not usually offer course exemptions or credit transfers from other programs or universities. Let's take a look at the core courses that you must take regardless of specialization. These core courses provide the foundational knowledge and skills for the specialization core courses. The first 3 core courses seen here have always been part of our curriculum. In these courses, you will learn the basic principles of psychological assessment, triaging, and crisis management. You will also build on your undergraduate knowledge of abnormal psychology by delving deeper into how to identify specific psychological disorders for different age groups. It is also important for you to acquire knowledge of research methods and statistics so that after completing your dissertation, you are able to contribute to research initiatives in your workplace. We have now added a 13-hour course on how to think critically about key ethical issues that psychologists may encounter in the field. This course allows you to participate in subject-specific ethics discussions that are part of all other MAAP courses. We have also created a new 26-hour course on psychopharmacology. This course will be taught by both psychiatrists, who are medical doctors, and psychologists. This new course ensures that you are equipped with knowledge of medical treatments that are available to clients and know how to help your clients accept both psychological interventions and medical treatments. Each specialization has its own suite of core courses worth 11 AUs or 143 hours. Here are the courses for our new clinical psychology specialization. As a trainee clinical psychologist, you will learn psychological assessments that are specific to work in clinical settings. You will also learn cognitive behavioral therapy, as it is a prerequisite for the third wave psychotherapeutic interventions that are used to treat moderate to severe illnesses. Counselling psychologists specialize in improving well-being and providing interventions to clients with mild to moderate mental health issues. As such, the specialization core courses here focus primarily on mental health assessments and a variety of evidence-based individual and group therapies. Special emphasis is placed on cognitive behavioral therapy because it is the basis of many modern therapeutic approaches. Psychoeducational assessment is the main focus for many educational psychologists. However, there has been increasing emphasis in the industry on behavioral and literacy interventions. Educational psychologists also have to be able to manage distressed clients. Hence, our curriculum covers all these areas. Practicum is what makes a psychology program applied because it helps you bridge the theory practice gap. We want you to be registration ready upon graduation. This is why you will be on practicum from the day that you start our program, and you will only complete practicum when you have clocked the full 1,000 hours required for registration with the Singapore Register of Psychologists and the Allied Health Professionals Council. You will spend your first 2 semesters doing practicum at your current workplace. This means that before you apply to our program, you need to obtain your employer's support for you to clock practicum hours in your existing workplace. Practicums 2 and 3 are spent primarily in the NIE Wellness Center and another practicum site. We will assign you with supervisors for all practicums. The Singapore Register of Psychologists now requires that applied psychology programs include dissertation. As such, we have introduced compulsory dissertation in our program. We will provide you with a list of available supervisors and research projects, and you can then approach the prospective supervisors before you start the MAP program and start work on your dissertation when you begin the program. You will need to complete your dissertation before your candidature period ends. We recognize that different organizations and industries may have specific needs over and above that offered by our core and specialization core courses. As such, we have introduced optional courses that you could choose to take during your candidature period. Optional course offerings may change over time according to industry needs.
It is possible to complete the MAP program in 2 to 3.5 years. The MAP website shows the study plans for full-time and part-time students. You are expected to follow the study plans, and it is helpful to take courses with other members of your cohorts. As you will graduate with 1,000 hours of practicum, you'll be eligible for registration with the Singapore Register of Psychologists and the Allied Health Professional Councils. Our MAP graduates are found all over Singapore in the civil service, public sectors, social service sector, schools, hospitals, and in private practice. Now that we have come to the end of our presentations, we can answer any remaining questions that you may have.
Hello, everyone.